thanks again to Matt for that session in the panel. It was like a quick fire IoT automotive question session, that one there. So great session, that. Thanks a lot to everyone who took part. So we're moving on now to the next session, which is critical IoT for healthcare. And I'd like to introduce you to our moderator, Elson Sutanto, the Principal Analyst at Juniper Research. So, hey, Elson.
Hi, Sam. Great to be here.
Thanks a lot. I'll leave you to introduce your panel. I think that we're missing some technical issues, but we'll continue with who's online at the moment. Thanks a lot.
Sure. Thanks, Sam. Good. So I'll just do a quick introduction to myself, and then I'll hand over to you and what we'll be exploring. So to the audience, good morning, afternoon, evening, wherever you're dialing in from. Thanks so much for joining this panel discussion on critical IoT for healthcare. We've got Alex Nash with us from Alcuris. We're supposed to have David Vigando from Sensoria Health, so hopefully he should join a little bit later as well. Hopefully, we've had some technical problems, but for now, I think we'll make this more of a one-to-one type of discussion, and it'll still be interesting to hear about Alex's story and Alcuris. And Alcuris actually won a key award in Juniper Research's recent FDA Digital Health Innovation Awards. I think you won one of our telemedicine and remote health awards with your partnership with ISI, pretty much for Alcuris Memo Digital Telecare Solutions. So, I mean, lots to talk about. Alex, why don't you just give us a little bit of an intro to yourself and Alcuris, how this all came about. Yeah, we'll take it from there. Please do introduce yourself. That would be fantastic.
Brilliant. Oh, thank you, Elson, for having me here. So, as you said, I created Alcuris actually out of university. And it was really on the back of my own experiences with my granddad. He had recently been diagnosed with dementia. This was in early 2015. And really seeing how his diagnosis affected him, but also the family around him, and trying to understand what technology could support not just him, but us as well. And realizing that actually there was very, very little. And what there was largely a red panic button that he could press. But if he pressed that, it would go to a monitoring center. But us as family would not know that he was okay. He also had type 2 diabetes, and we didn't know whether he had taken his reading. We didn't know whether what his blood sugars were. And it was around that sort of time that IoT really started to be developed. And I thought, surely this industry is perfect for disruption using IoT. And that's really when I set up Alcuris with three main aims. The first, to prolong the independence of older and vulnerable individuals. The second, to provide reassurance of their well-being to friends and family. And the third, to provide critical insight to local authorities and care providers. So it's those three things that we've really focused on doing with both a data analytics platform, but also with our own hardware as well.
Great, interesting. And how long ago was that, Alex? Just to get a time frame of how long this has been going for.
Sure. So real time frame, I suppose, was first employee was October 2017. And then since then, we've sort of built the team up to around 15 people.
Right, sure. And clearly you see the importance of real-time data, real-time feeds, the quality of data, as well as pretty much being able to capture that data. So take us through the thinking of where to start. I mean, this is quite a big project. Clearly, we can see that the benefits and advantages of having such a business model in place. How did you kind of map this out in your first stages and take it to where it is now?
Sure. So we actually started from a point of view of not necessarily looking at the data, but looking at what outcomes we wanted to have. So what did we actually want to achieve for both family members? What did we want to achieve for local authorities? And then actually working back from there. So knowing that, say, a family member wanted to know when mum or dad was okay, what somebody's blood pressure was, knowing that a local authority wanted to be able to look at data both at an individual level, how is Mrs. Jones doing, but also at a population level. Actually, this cohort of individuals that have had 20% more domiciliary care this week, how has that affected them? So we then sort of went back from there to look at how we should structure the data, looking at both sort of, things like, relational versus non-relational databases, and then working back down to actually what sensors do we need, and how real time does the system need to be? Does it need to be real time or not real time? And it was all these sort of discussions that really helped to frame the architecture that we ended up developing. And that was actually one that we said real time is really important. We need to be able to get large volumes of data in reliably, and being able to then sort of sort that data as well in sort of as close to real time as we can.
Sure. Very interesting to hear that overview. Do you also see any potential to perhaps partner with any other kind of healthcare players going forward, given what you do?
Absolutely, and it's we've sort of almost come full circle. So when we first started, we had to develop our own hardware. So just to sort of give a little bit of information around our particular market, it's a market that's dominated by social alarms. These are red panic buttons that when you press, enable a two-way phone call to a monitoring center. So what we wanted was to have that functionality, but then to build in both IoT at both a sort of device level, things like door sensors, motion sensors, smart plugs to know when a kettle's been turned on, but also health devices, so blood pressure, heart rate, etc. Because that hardware platform that was both social alarm plus everything else didn't exist, we ended up developing our own hardware, which is sort of this box here. But actually, as we've been going forward, other companies, other manufacturers have started to develop their own hardware as well. So what we're far more interested in now is, as you said, partnering, working with other suppliers, other companies to bring their hardware and devices into our platform. So as a local authority customer, they have a single platform that can then use the best of whatever is available, because there's no point talking about the best of what's now, because in 2 years, there's going to be health devices and new types of sensors that we just don't know about right now. And at a platform data level, it needs to be capable of pulling in this new type of data.
Definitely. And also to add to that, do you think you had just also a mixture of the right knowledge, partners, people to work with, understanding the business model and the problem and the outcomes that you wanted, but also the timing? You were mentioning earlier how when you were first, drawing this up back in 2017, 2016, you could see that the ecosystem in terms of IoT was ready for something like this. You just helped to kind of push and launch that or make some way to it. Do you think if there was a different time before that, maybe it would not have been ready, but it still would have been possible? Or share some of your thoughts there, really, because sometimes they say the ecosystem's not ready. There's these great ideas to do with technology, but we're not quite yet there. So any thoughts on that would be fantastic.
Sure. I think it is hard to say. I think IoT on mass in terms of working at both at a sort of consumer level had really only been sort of proven, I suppose, a few years earlier at sort of a large level, most likely with Hive. From British Gas, and I know some of the early team there. They did a really, really good job, but they were also sort of pioneers in actually how do you take large amounts of data and ensure that a system is working at that level. So actually, there was the technology side that I think we had the right timing for. We could look at a lot of the lessons that other people had learnt and develop our platform based on that. But then the more important traction really for us was actually the market. And the market wasn't ready then. And actually only now is the market really becoming ready for this new way of working, largely driven by, in our sector, the analog to digital switchover of the phone lines. So if you look at the UK, there's 1.8 million alarm devices. 80 to 90% of those are all analog. They require analog phone lines to work. With the analog phone line infrastructure rapidly disappearing and completely being replaced by 2025, these devices really need to be upgraded to a digital product. And that has really been the catalyst for the growth in our industry, coupled with some of the new emerging bodies and organizations like the integrated care services that help to actually combine both health and social care into a single sort of buying force.
Sure. I'm with you. I totally understand that. And just to touch a little bit more, going back to partnerships, tell us a bit about the how the collaboration with ISI, who are in the eSIM space, how that came about, and really what challenges or problems that was solving, really, that collaboration, that partnership. How did it help things progress further for you and for Alcuris, really?
Absolutely. So as you said, SI have been a great partner to us. We were looking at sort of the landscape of sort of cellular connectivity and which SIM cards were suitable for us. And we knew from the very beginning the sort of functionality that we needed. So we knew that we needed to have true roaming. We knew that we needed it to be a global SIM. We knew that we needed to have things like data pooling as well. Our CTO ended up saying, well, actually, somebody I went to university with is involved in this company, and it was SI. So we had an initial meeting, and everything that we'd essentially wrote on sort of piece of paper, they could tick off and say, yes, we can do this and we support it. And the added bit that they offered, and from some of the early conversations that have been happening in some of the other sort of webinars here around security, was their security feature, which enabled Amazon certificates to be delivered via the SIM cards. And that for us was a really, really useful feature that gave us essentially another way to access the security of our platform, but also to block people that are trying to do denial of service attacks, etc. And really from then, it's then been working with them collaboratively to make sure there's as much integration between their platforms and ours as possible.
Sure. Interesting to hear. Just to move on a little bit about, again, challenges and perhaps to address that you'd like to see really kind of be tackled to help further growth of this sector and, and Alcuris. Do you have any thoughts around that, about what could be done? I mean, it could be on anything like interoperability, procurement processes, or, lack of link between health and social care. I mean, you tell us what you think are the top priorities to really kind of iron out.
Absolutely. One of the biggest challenges in our particular market is around interoperability. You have some very, very large dominant players that have largely not really changed their offering for the last 15 or 20 years. They tie people in with their platforms or their types of devices that are using particular protocols and frequencies. But actually, IoT is all around being interoperable. So what we're really looking for is a push for new interoperable standards at both data levels, but also device levels that local authorities and government can really get behind in our industry, which then opens up some of these procurement exercises that are happening right now. And that's really what we're looking forward to. And we're starting to see some of the early signs. Our industry body is the TSA, the Telecare Services Association, and they've really been pushing interoperability as one of their core goals for this year. You mentioned as well around health and social care. That's another enabling catalyst for our market. Typically, anybody that's sold into social care will tell you that there is this sort of wall between social care and health. And if you're selling into social care, but the benefits are largely being seen in health, they will say, well, why are we paying for this if we're not seeing the direct benefits? That's really where the ICSs, the integrated care services, are coming in to bridge this gap and to help deliver services that can both offer value to social care, but also to healthcare.
Fantastic. Thanks. Thanks so much. We're just getting a couple of questions in here. I think I'll pick one to throw to you as well to change it up a bit. So I have something here from Francis. He asks, what are the key drivers for healthcare organizations adopting IoT? I mean, clearly you explained your story at the beginning with your grandfather, and this is a very common kind of challenge faced by many families, many people worldwide, which helps it really to scale. Do you have any other offshoot thoughts to answer that question on other kind of drivers for healthcare being adopted?
I think it really depends on your organization. If you're a large incumbent, you have very different challenges to a smaller startup. So a large incumbent looking at this really has to be trying to understand the business model. A lot of large companies are used to selling devices. Oh, sorry, there's a bit of feedback. Might be
I think it's me. I've got to go on mute when you speak. So bear.
Okay, brilliant. So yeah, with large incumbents, one of the big challenges that they have is understanding how IoT will affect their business model. Lots tend to be used to selling sort of particular their own devices and their own platforms. IoT obviously opens things up far more, and that's what they need to try to understand. They've obviously got the size, so you've got less challenges around that, but it's really around business and service model innovation. For startups, it's how you win the trust of your customers. So it's around security, reliability. I think too often people think that IoT is far easier than it really is. You know, IoT is very easy when you've got a Raspberry Pi and a couple of sensors. When you've got 10,000, 100,000, a million connected devices all sending data in, it becomes far, far harder at both sort of architecture and a system reliability point of view.
Totally, and you know, just to add to that, I've also heard that there have been discords between, particularly in large organizations, between the operational guys and the IT guys and the CEOs and the different languages spoken, really. So I guess that coordination internally has to be crystal clear, right, about how to handle the technical side of things, the operational side of things, and so forth. So yeah, I suppose that was areas that you made sure that was very clear between each and every person in your team.
Absolutely, and that's one of the advantages of being a sort of an SME, is that sort of each department has complete awareness of other departments and all knowing exactly what our goal and ambition is. And there's a lot to be said from being able to start from a sort of blanker when designing a sort of new IoT ecosystem, rather than trying to adapt something that you've already got and squeeze it into a new service model.
Definitely, for sure, for sure. Yeah, and just also to move on to another interesting question, really, is really kind of like forward-looking, looking really at the future outlook. So looking at the digital health space, but also trying to understand where do you see things going for your particular area of kind of operation? Do you see, you know, better scaling, but also because you see we've got different regions or different markets that are whose healthcare systems are at such different stages of development and maturity. Yeah, give us a bit of an overview of what you think about this kind of evolution or progress of the healthcare system and for solutions such as yours.
I think you're really going to see a move away from companies and services being based around particular devices to an operating model which is more around, you know, these are devices that we have, but you can also bring your own device, whether that be a device made by Apple, Google, etc. That's really been one of the really interesting things over the last 5 years or so, is the increase in consumerization with devices, in particular with healthcare devices. And it's understanding how you fit into that ecosystem. So for us, it's around how we can pull whatever is the best data that we can find, whether it be from a heart rate from an Apple Watch or the activity data from a Fitbit, and pull that all together in one place. I think that's really driving the market now, and people taking more ownership and control over their own health as well. Sure,
totally understand that. Do you also see an opportunity for something revolving around data analytics? There's an awful lot of data you're collecting on these users, their habits, lots and lots of different trends and developments that you can see. Do you see some of that helping to fit into future, say, products of yours, or even collaborations or other partnerships that you might have with other players?
Absolutely. So I would never describe us as an IoT company. I don't really understand when a lot of companies call themselves an IoT company, because IoT is a sort of means to an end. Really what we are is a data analytics company. Now, Internet of Things enables us to be able to collect lots of data from a diverse sort of set of devices and sensors. But the value that we bring is being able to analyze that data, learn behaviors about an individual, spot changes in their behavior, and then let the relevant people know, whether it's a family member or a local authority. at both individual and population levels. So absolutely, the analytics is what is, for my business, going to drive us forward. But I think for many businesses that use IoT, really they are data analytics companies.
Sure, sure. Can you also see perhaps a way forward where you've got a kind of predictive analytics to kind of share with particular users or consumers and say, okay, this is how we've gathered the data and the trends, and we recommend that, you know, XYZ can be taken as an action, or to kind of better health, or to help with monitoring.
Absolutely, and that's our goal. So right now, we can do something very simple, which is looking at a motion sensor that goes into a bathroom, and we've got a pretty high rate of being able to predict urinary tract infections, because you see a rapid increase in bathroom visits beyond what we would normally see for that individual. So that's a relatively simple sort of early predictive use of data. Where we really want it to go is being able to pull in the data, not just around what an individual is currently doing, what their blood pressure or heart rate may be, in the activity levels, but what was their history? Do they have a history of heart failure, etc.? What support are they also getting? Do they also have a domiciliary care package as well? And actually, what's their levels of activity in the home? Has it started to drop off? And where have we seen this similar behavior before? What has it led to? So then being able to learn what sort of intervention can happen in order to keep that individual at home for as long as possible, completely moving to that sort of proactive and predictive approach to care.
Sure. I mean, this is really, I guess I'd stress on this a lot, because there's a lot of valuable insight you have there that could feed into, I don't know, I mean, you know the space better than me, but local authorities or hospitals that you could share, records with. There's a lot of open possibilities, isn't there, to really kind of share that with other kind of players and really better the patient, so to speak.
Absolutely, and one of the biggest things that I've seen over the last year is the increase in being more open with data sharing. Now, it's obviously a sort of double-edged sword. With being more open with data, you have far more sensitivity, privacy, and consent issues around that. But these are challenges that are being solved now.
Yes.
It's something that we certainly looked at from the very outset, and with health and medical data, I think the NHS is certainly on that path to be able to share far more data with other companies based on obviously a very important consent model.
For sure, for sure. Dare I ask as well, was COVID quite a catalyst as well? Did that speed things up, do you think, in certain areas for you in terms of development, in terms of moving certain partnerships forward and other areas?
COVID, it helped us in some areas, it didn't help in others. So the area that didn't help us very much was that due to local authorities being under so much pressure, they weren't really looking at service innovation. They were looking at sort of firefighting and patching holes. So things like video tablets got deployed in quite high numbers. But platforms like ours really require service innovation. And what I very quickly mean by that is, if you're used to responding to an event when somebody presses their panic button, that's very different to now knowing what to do when we tell you that somebody's at risk because their behavior has changed. Well, what does that mean? What do we need to do to intervene? It's not something you can suddenly do within a week. So in terms of actually putting large amounts of units out, that was challenging. But actually, what it has led to is a far better awareness of how remote monitoring can really help and support. So the amount of local authorities that said, if only we could just post out an SpO2 monitor to 1,000 of our sort of residents, so they can start monitoring their own blood oxygen levels, and we could pull all that data into one, would have been brilliant. And that's exactly the sort of thing that our platform enables. So it really has highlighted the value that having this sort of platform can provide.
Sure. So how does that work? Did you proactively, liaise with them, or do they put a tender out? I'm just curious how that actually works.
So with local authorities, they tend to go to tender. We talk about partnership. We're also actively working with 3 of the largest community equipment providers in the UK that also have the customers. So there's a number of ways that we can access local authorities, but largely they're via quite large procurement exercises that come out that we then bid for, often with other partners as well.
Sure, sure. And what would you say is next for Alcuris? Are there any particular new markets or segments you want to get into? Tell us what future plans are, without revealing your secrets, of course.
Absolutely. So we're just about to close off our funding round. I think it's open for another couple of weeks, which is going very, very, very well. So that will really enable us to scale far more rapidly. Over the next few weeks, we are expecting to find out that we've won some very large tenders, which will be sort of flagship accounts in the UK that can really demonstrate how moving to a proactive and predictive approach to care is valuable, and the value that then provides. So we're looking forward to being one of the first companies in the UK to be doing this at scale, if not the first. That's really going to be happening over the next 6 to 9 months. But as well as that, coming again back to partnerships, we're in talks with some very large players in our industry to become their data analytics and platform of choice that they use when they provide their own devices. So lots and lots of very exciting things for Alcuris coming up over the next 12 months.
Wonderful, wonderful. We wish you the best, and thank you for taking the time out to inform us of all this. It's been really insightful. Well, we're just coming to the end, but I think we've got a minute left. Then if that's all right, Alex, if I can ask you to just sum up some key takeaways that you want the audience to know, maybe about the industry, maybe about what you're particularly doing at Alcuris, that would be really great as a key takeaway.
Sure. So I think when you're looking at sort of IoT and health, I think the single biggest thing is looking at how IoT can really change the service offering, and it's all around service innovation. I think that's the key thing for anybody looking at this market. It's certainly the key thing for us. We're not doing IoT because of the sake of doing IoT. We're doing it because the value that it can give. If you can predict somebody's change in behavior and know what intervention to put in place, you can keep people at home for longer. And that really comes back to the very reason why I set Alcuris up, which was to prolong the independence of people like my granddad, provide reassurance of their well-being to people like my family, and insight to the care providers that providing support packages to my granddad. And if we can achieve that, then I'll be very, very happy.
Definitely, definitely. There has to be a point and an objective to all this. So wonderful. Well, I think we're out of time. Thank you, Alex, for joining us and for this one-to-one interview. We wish you the best with Alcuris. And yeah, thank you everyone for joining.
Thank you for having me here.
Thank you.